Many of you feel that lasers are the answer to fixing your skin and your anti-aging changes. It's a laser, it sounds super high-tech, but what if I told you that they're not necessarily the best long-term solution? Today's topic on Skin School is lasers versus skincare. Let's see who wins. Hi everyone, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. While lasers are an incredible tool for short-term skin changes, it is not slowing the aging process down. After 20 years of treating patients in facial rejuvenation and facial plastic surgery, I have found that a properly prepared anti-aging skincare routine outperforms lasers and costs thousands of dollars less. Many of you probably are gonna find what is coming up in this video to be somewhat of a departure from the conclusions that you've reached. Keep an open mind. Listen to my perspective and ultimately come up with your own point of view and see where you fall with this. So let's take a few moments and break down some of the most common lasers and what the limitations are, what they do and what they don't do. So the first category, probably one of the most common lasers, is the IPL or BBL. Now, this is a segment of light. It's not an actual laser, but it's used to target brown spots and in some cases red spots. So discoloration is what its target is. Commonly done between 3 to 6 treatments. The underlying reason why pigmentation is coming up is because as we age, there's an overstimulation of the melanocytes due to UV damage over the lifetime, etc., and those pigments end up rising and they look like nests of pigments on the skin, discoloration. But it's extremely effective at clearing brown spots and temporarily holding back red spots. What it doesn't do is it doesn't resurface the skin, so the dullness and dryness of the texture, the roughness of the skin still will remain. It also doesn't do anything to improve fine lines and wrinkles. It doesn't do anything to stimulate collagen, so that component of skin aging is completely out of the treatment zone. And the average cost per session is typically $300 to $600, so totaling somewhere between $900 to $3,600 for a treatment. The typical downtime for an IPL is pretty mild. You're gonna get kind of a hyper darkening of those spots, we call them coffee ground pigmentation, and then they begin to peel off, etc. So it could be anywhere from a few days to a week or so, depending on the nature of it. But it's definitely not no downtime. That's the key here to understand. This is a common theme. Now, this is what I've always found it frustrating. You go in and you get these lasers, or in this case the IPL done, and you clear all this pigment from your skin. And many of you who've done this will attest to this, I'm sure, and please feel free to drop your comments in this section. Let me know what you think, but this is what I've seen. You clear the pigments, 3 to 6 treatments, things look really good. 6 months later, a year later, all those pigments are back. What do you have to do? You have to do another series of these treatments. You can also convert the series after you've done them into a maintenance where you come back every 2 to 3 months and you do another 1 or 2 sessions of IPL to keep the pigment down. The reason for this is you're not doing anything to suppress new pigments from forming. And if you don't suppress it, you're gonna be in this need for constant use of the laser to basically clear, almost like the leaves falling from the trees in the fall and you go out and clear them, and then what happens next fall? They all come back again, right? So the idea here is it's short-term in terms of the improvement. It's definitely effective, but it's short-term. Next is micro laser peels, or basically superficial resurfacing. We do this a lot in our practice as well. We use the Erbium YAG by Cyton, and what this is a very, very thin laser resurfacing, basically to work on the upper epidermis to help with very, very fine lines, but mostly just rough texture, because remember the epidermis begins to accumulate dead layers of keratin and just cell debris, and as a result the skin doesn't look vibrant. It doesn't have that brightness or luminosity. It's dull, it's rough. So micro laser peel is kind of this nice compromise because the downtime is shorter. It basically takes, I don't know, anywhere from, again, a few days to a week or so, depending on how deep the micro laser peel goes, and it's, again, also done on several treatments. So what it doesn't do is it doesn't address deep pigments, which you get with IPL or BBL. It also doesn't address fine lines and wrinkles that are a little bit deeper because this is just too superficial. So how much do these treatments typically cost? The average treatment for something like this is anywhere between $700 to $1,500 per session. It's a big range, and of course, you go to a premium provider and a big practice, et cetera, with high demand, that cost is definitely gonna be much higher than that, but this is kind of a national average. Full treatments, typically when you're doing a series of them, anywhere from $2,000 to $4,500, somewhere in that range. So keep these numbers in mind. And we'll put this all in a newsletter, the Karam MD Journal. We'll link it so you can check it out and refer back to it. And by the way, if you haven't already, make sure you subscribe to this channel, because this type of information is really, really helpful in terms of guiding you and making good decisions, and we want you to be in the know. So let's look at the next treatment, deep laser resurfacing. Now you can use CO2 laser or you can use erbium YAG. I personally prefer the erbium YAG. That's what we use in our office. The reason I prefer erbium over CO2 is because it's much less, call it invasive if you will, but the invasiveness isn't because the laser penetrates deeper. It's because CO2 causes more non-specific thermal energy, which means that the radiant area of heat is going to be greater, and as a result, the skin's going to be more red and swollen, and recovery as a result is going to be significantly longer. So nowadays, CO2 deep resurfacing is hardly done. It's mostly using erbium. Beautiful laser, we do it in our practice. I used to do a lot more of it. I'll tell you why we don't do as many of these today as we used to, but we used to do a lot of these, especially in combination with surgery, because it takes roughly 2 weeks, sometimes 3-week recovery, because you're going much deeper than you were with your micro laser peel. You're now chasing the depth of the wrinkle in the upper lip, which is a beautiful treatment for vertical lip lines, actually my favorite treatment for that. And it also helps get rid of pigmentation because you're going much deeper. You're actually getting to the dermis where a lot of that pigmentation lives. Downside, number one, big recovery. Number two, it doesn't address deeper pigments. So there's some of those deeper pigments still may reside where the IPL and BBL penetrate a little bit deeper. Additionally, the process of skin aging isn't stopped by this. What you're doing is you're improving your skin significantly, and then you reset the clock, and now the clock is going forward again. So the average cost for a deep resurfacing can be anywhere from $2,500 to $5,000 per treatment. Now, this is very, very, very average costs. All these lasers definitely are going to be handled better by expert practitioners and things like that. So I know for sure some of these costs on the high side are actually very average costs for an experienced person to do them using the best technology, etc. But nevertheless, it's around $2,500 to $5,000 for a full face laser resurfacing. Next category is fractional resurfacing. Fractional resurfacing are things like Fraxel, they're things like Halo, Profractional. These are great treatments. They've come to light because deep resurfacing causes too much recovery. Non-invasive like the IPL and BBLs don't necessarily address everything. So the idea was to blend some of that. So like for example, the Halo and the Fraxel use a combination of light therapy in addition to a fractionated resurfacing. Fraxel uses CO2, Halo uses erbium. And the idea here is that you're getting this kind of a blended effect. Now, it does not treat the entire surface of the skin, hence why it's called a fractionated laser. It's only treating a fraction of the skin. How much does it treat? I mean, anywhere from 11%, it could go up to 22%, maybe a little bit higher, 30%. But at the end of the day, the majority of your skin is not even seeing the laser, just little dots, columns of laser hitting into the skin at those fractionated ratios. The issue here is you're gonna need multiple treatments. The benefit is it's shorter recovery, but it's not zero recovery. You're looking at 2 to 3 treatments in general. So let's look at the average cost. So the average cost is between $900 to $2,400 per session, and so totaling anywhere from $2,700 to $7,200 a treatment per year. So these are expensive procedures that people are doing all the time. They do it in my practice, they do it on every practice down the road, and many of you have probably participated and done these treatments for yourself. Now let's look at the real cause of skin aging. In order to understand what tool you're gonna use, you should understand what is actually happening to your skin. The key to keep in mind here is that skin aging is multifaceted, affecting a lot of different aspects of the skin at the same time. Number one, first and foremost, is decreased collagen production. At the cells within the skin called the fibroblasts. Maybe it's a direct result of decreasing estrogen over time. Maybe it's just the way the cells are wired genetically. But what they do is they stop producing as much collagen as they used to. And as a result, the collagen is what creates the matrix of the skin, in addition to keratinocytes, in addition to elastin. But basically the building block of skin is collagen. As this decreases over time, skin becomes thinner. And as it becomes thinner, it becomes more crepey, it gets lines and wrinkles. And this is what makes skin kind of look loose and not firm and structurally sound. The next series of changes have to do with pigment production. The cells within the dermis, once again, instead of dampening their pigment production during youth, because you look at like a 20-year-old, their skin is flawless. There's not a single sunspot on it. It's beautifully evenly toned. And then as you get older, you start to see sun damage coming through. That's because the melanocytes are producing at a higher rate pigment, which in this case is melanin. And melanin, as it travels up into the dermis, they consolidate into sunspots or discoloration to the skin. And that's where the uneven tone of the skin begins to show, instead of that porcelain clear even skin tone. Next is the accumulation of all that dead stuff on the skin, right? The keratinocytes that I told you about, the dead cells, and it just starts to build up on the epidermis and the stratum corneum, which is the upmost layer of the epidermis. Once that happens, as a result of the cell turnover and sort of self-exfoliating function of skin becomes dull to light, so you lose that beautiful light reflex. In addition, it becomes rough to touch. Those are the textural changes that happen to the surface of the skin. That can also lead to enlarged pores, because the pore is literally a conduit for the sebaceous glands within the dermis to excrete the oil that they produce. But if the surface of the skin blocks them from being able to excrete this, what ends up happening is oftentimes they can get enlarged and dilated. This is where exfoliation comes into play. And if that wasn't enough, there's also a loss of hydration to the skin. The skin stops producing as much hyaluronic acid, and hyaluronic acid is the natural sponge in the body, in the dermis, that basically attracts water and causes the skin to look supple and firm and plump. When that begins to diminish, the skin starts to look deflated and thinner looking, in addition to the changes that are happening with collagen. So those two things combined give skin that flaccid and weak look, as well as dryness and increased sensitivity that comes with aged skin. So when you think about aging skin, you're thinking about it as being dull, dry, lines and wrinkles, discolored, rough to touch, and overall thinner and looser looking. That's aging skin in a nutshell. And as I mentioned, with each of those lasers, they each target a very specific part of this multifaceted skin aging process. None of them address all of them, and many of them address none of them. So at the end of the day, lasers are very, very good for specific problems, but not for all problems, unless you want to use them in a variety of ways. So you want to use some IPL and use some resurfacing. You're going to get pigmentation improved, then you're going to get discoloration improved, you're going to get roughness and fine lines and wrinkles improved, but you're not going to do anything to dryness per se, you're not going to do anything to pores. So there's all this, aspects that cannot be addressed with lasers. And if you try to put them all together, well, everything that I mentioned in terms of cost doubles and triples, right? Because you're bringing a lot of different lasers together. And this is an approach that many dermatologists and laser experts do, is they use a variety of different lasers to accomplish what they're hoping to get. But as you can understand, that does drive the price up because you're adding on a variety of different procedures. So this is where it gets interesting. This is why I believe skincare is the best long-term solution when it comes to truly fighting the changes that are happening with skin aging. And the reason why is because a carefully crafted, comprehensive skincare routine that includes all the right actives is addressing each of those changes that I just mentioned head on. And let's look at these one by one, and so you can understand where the particular active ingredient fits in with the changes that you're looking for. So these are the ingredients, the must-haves if you're trying to get youthful looking skin. So fighting fine lines and wrinkles and skin thinning. The thing you're trying to do is stimulate collagen. What's the best way to stimulate collagen using actives? Well, number one, include retinol, include vitamin C, include niacinamide, and include certain peptides. These are all working at the cellular level, at that level of the fibroblast, and affecting its DNA to stimulate collagen production, even though biologically, with age, it wants to decrease it. So you're basically turning the engines on after your body has turned it off. This is so key and so beautiful from a molecular biology point of view. So what about sunspots and pigmentation? Here you want to decrease the production of melanin at the melanocyte level. So what you're going to do, there's an entire pathway of melanin assembly. And what you're doing is you're bringing in specific active ingredients at each of these points, basically blocking the pathway where melanin is produced. So you're stopping the cell from even being able to make melanin. I mean, how genius and beautiful is that biological manipulation of the system? So what are those ingredients? Well, retinol plays a role there. Vitamin C plays a role there. Even niacinamide has a role in that. But there's a whole host of botanical ingredients like daisy flower, licorice root extract, azelaic acid, and by using these actives on a regular basis, what you're doing is basically stopping the body from producing it in the first place. So even if you had a laser done and you cleared all this pigment and you're on these things, well, guess what? Your pigments aren't coming back. That's the beauty of it. And if you didn't do a laser in the first place, slowly but surely, those pigments, as they begin to slough off of the surface of the skin, you're gonna start to see fading and decreasing of these pigmentations on the surface of the skin, which is a beautiful thing without even having to address them mechanically or with a laser. Fine lines and a deflated looking skin. This is improving the skin barrier as well as hydrating the skin. So what are those actives necessary there? Well, number one is hyaluronic acid. Sodium hyaluronate specifically is a much better solution than hyaluronic acid, but for the sake of just talking, we're going to say hyaluronic acid. What this is going to do is it's going to attract water. We call it hydrophilic, water loving. So it brings all this water and it causes the skin to plump up. And that plumping effect can happen very quickly and make the skin look a lot better right away. A skin that's plump and has good turgor to it is going to function better. It's also going to have less kinkage and breakage of the channels that create pores, so even it helps with pore management as well. But using lipids and ceramides to give the skin that oil that it needs, it improves the barrier function. It also decreases the body's need to produce as much of the oil, and as a result, fine lines and wrinkles, as well as pores start to improve. What about that roughness, that dullness, which I think is one of the biggest tells of tired and aged-looking skin? Well, that is all coming down to exfoliation. So exfoliation, especially for mature skin, is an incredibly important part. Exfoliation can be done using a number of different products. We did an entire video on exfoliation, but the concept is there's chemical exfoliation, alpha hydroxy acids, BHA, but there's also enzymatic varieties. There's the ones that we use in polish, papain and bromelain, to break down that surface thickness of the skin and cause the skin to give that brightness back. They can be mechanical, like bamboo, little particles that kind of roughly do this. You could use exfoliants, like what we just talked about, but also there is an exfoliating effect of retinol that is really, really important. So the use of retinol on a regular basis slowly but surely exfoliates the skin and keeps cell turnover high enough to where you don't get that buildup of that dead cell layer on the stratum corneum. Very important. Maintenance keeps it nice and clear. I just mentioned a lot of different ingredients. All of these things are in the Karam MD trifecta. They're in the right doses and combinations to be able to get the changes that we're talking about in a very reliable way. But this is what it takes, my friends. This is actually what it takes if you want to really efficiently get your skin to go ageless and get younger. Lasers is a temporary kind of a step. This is a continuous month over month, year over year. In a period of a month of skincare versus lasers, lasers win every single time. Lasers will crush skincare in the short term. You're just taking off the entire upper layer. The skin's gonna look immediately better as a result of almost any of the things that we just talked about. But in the long run, months and years down the road, without question, lasers will not outperform skincare. Skincare will win every single time. I've seen this with countless patients in their 70s who've been doing this type of thing their whole life. When we just showed a video of Michelle, one of my patients, she's 70, who's got like skin basically of a 20-something-year-old. Netta, my wife, who's been doing skincare only since she was in her 30s, basically, in the last several years, and only trifecta. Her skin looks incredible. We've never done a resurfacing laser. We've never done a chemical peel. We've never done any of these things. Whether you think I have good skin or not, I don't know, but I have never done a laser or a chemical peel or any of that treatment. I've only used the trifecta. And I'm 52, by the way. The bottom line is, over years, you're going to architecturally change your skin to a more youthful look. And that's important. You want to get to the root of the aging problem, not treat the symptoms of the aging problem. It's a completely different concept. I'm going to tell you 100% for sure that skincare, even with the trifecta, and you can get combinations that are less expensive than the trifecta, but make sure you get all these components in there. You know, if you're on a budget and trying to get all the benefits out of it, just make sure you're on a comprehensive approach like what is in the trifecta. Obviously, I can't promise how different brands and different formulas work and interact with each other. But bottom line is, you will 100% spend less on skincare in the long run than you will on lasers. Now, again, I love lasers. We have them all in our practice. We do them on a regular basis, but this is just the reality of it. Maybe if you're just starting from scratch and you wanted to kind of get ahead really quickly, you do a nice deep resurfacing, you do a contour TRL, you get all those things out of the way, and then you start something like the trifecta and keep those at bay, keep them down so you don't have to repeat the lasers. Another reason I'm extremely passionate about this, because I'm a big believer in opportunity cost. Skin is actively aging all the time. And if you make some poor decisions along the way, you're not on the right products, or you think like one laser a year is your skincare routine, you're gonna basically make a decision that could cause your skin to continue to age, and you're doing nothing to stop it. And that's not what you're doing all this for. You're doing this because you want youthful, glowing, beautiful, flawless looking skin. And you can achieve this. If you choose you want to do lasers, do them in conjunction with skincare. Don't do them in place of, is the lesson here. And if you want to do one thing, I personally would choose skincare over lasers for the reasons I've just outlined. Now, I'll tell you an anecdote, and this is 100% true. It's amazing how often we used to do deep resurfacing as part of our vertical restore or facial rejuvenation. In the last year or so, it's come down to maybe once or twice a year. We used to do 1 or 2 a week, maybe more sometimes. It was just like standard. We used to do them together. The reason is the majority of our surgical patients get started on the trifecta before they start their approach to surgery. So they have a consultation with me, and we may even plan on doing a laser because they just got started, and on the consultation they look like they could definitely benefit from that, that big laser, and then after surgery they can continue on with the trifecta. It's a great time to pair up those downtimes together. 9 out of 10, maybe more. By the time they show up for their surgery, we cancel the laser. No exaggerating, no joke. It is unbelievable how effective consistent use of long-term skincare can be. I've seen it with my own eyes. I've seen it with people who've been doing this who have nothing to do with me. They've been doing this approach their whole life. The sun protection, by the way, is like a key starting point to all this, as well as that. And then, it just works. And it's the approach that, like I said, I'm taking and my wife's taking, and how I recommend majority of our patients to do. So I'm sharing this with you from that point of view. So now that you've watched the entire video and you've heard my perspective on it, and like I said, it might differ from perspectives that you've heard elsewhere, or the perspective that you had going into this video, I'd be very curious. Drop them in the comments below. Ultimately, you need to make up your mind based on the information that you have in front of you. But I'm just curious, did it make you think, slightly differently about the process? And if you want this information in a written form, look for the Karam MD Journal link. Any questions you have, drop them below. If you haven't already, make sure you subscribe, and definitely share this with some friends and family. Let's spread the word. Always a pleasure sharing all this stuff with you. Stay tuned for another video, and until next time, Dr. Amir Karam.